A common sight when walking down the halls of Mason High School is a sea of teenagers with their heads buried in their phones. Sometimes these students are so engrossed in their device that they don't even come up for air. They keep their heads down and plow through the hallways. Not only are kids bent over staring at their phones, they're using laptops and Chromebooks for their schoolwork. But this all comes at a cost. According to local chiropractor, Dr. Matt Slater, this is having a negative impact on our posture.
Especially when the iPhones came out, early 2000s, early mid 2000s. You definitely see a rise of younger kids. Even kids as young as 7th, 8th grade. As soon as they get those smartphones, you're starting to see these kids having issues, having more headaches, having allergy issues, having neck pain, things like that. Because what happens is, looking down a lot posture-wise, it affects the neck. So the picture on the left is a normal picture. I call it normal as a gauge of what we want to go by. As an example, I'll show you the difference of what can happen when somebody's posture, you're looking down a lot, let's say working on the phone, right? Or your iPad. I feel there's a direct correlation. You're definitely seeing a lot more of these kids having a lot of issues related to the phones. So yes, there is other things that come about from that, the headaches, things like that, and you will also get where people have upper back pain, okay? And that's going to be when your head starts coming forward, all these muscles in the back are affected because they're working hard to help keep your head up, okay? So these muscles, everything's getting tight in the back, and they start getting you'll get a little hump at the top of where your cervical spine meets your upper thoracic spine. So what I tell my patients in between treatments is working on stretches, things you're trying to reverse that posture, right? So if you're coming here, you want to stretch here, doing chin retraction stretches. So the more you can stretch in between those adjustments, the better you are going to be in between those adjustments, and your adjustments are going to do better. You're going to hold those adjustments better. And so doing those stretches and those exercises are going to help prevent some of this getting worse, and then also helping correct some of that.
When the problem presents itself, Dr. Slater makes it his priority that patients are seen as often as possible. He performs multiple adjustment procedures in hopes to quicken the recovery process. Hopefully, teens will start to recognize these issues and take their own initiatives. I'm Ella Rush, NBC News.